Hey everybody, welcome back to my YouTube channel. Today I want to talk a little bit about what is an occupational therapist. It's a little bit confusing for a lot of people. And to this day, 25 years in, I still have people call me a physical therapist. So I really want to get out there what is an OT and then kind of compare a little bit about the differences. So for those of you that don't know me, my name is Heather Molamicki. I own Healing Hands Therapy Center in Collinsville, Connecticut. I am an occupational therapist. I'm also a certified hand therapist, which that term is a little misleading, and we're going to do a video on that at another point in time. But a certified hand therapist is somebody that actually specializes in the shoulder, elbow, wrist, and hand. And in order to be a certified hand therapist, you either need to be an OT or a PT. Predominantly, probably the higher percentage of CHTs are occupational therapists, but there are some amazing PTs out there that are CHTs as well. Lots of acronyms. Oh my God. Anyways, so as I said, my office is in Collinsville, Connecticut, though I do things online as well. I run a lot of different programs. I do some lectures for musicians, and I do a lot of different telehealth and coaching sessions. So today, what the heck is occupational therapy, right? So we all like it. It seems a little confusing. Do we get people jobs? Do we train people to do their jobs? What is it? What is it that we do? All right. So one of the main things that brought me into occupational therapy is that it's all very much mind, body, spirit oriented. Okay. It's very much a holistic approach to taking care of people and helping people get back to their daily occupation. So that's where the word occupation came in from. All right, is we look at things, that occupational aspect of things, that are not helping people get jobs, but we're helping people do the jobs of their everyday task, figuring out what is wrong. Where are things breaking down in the body, in the mind, right? In the cognition aspect of things, in the emotional aspect of things. Where is the breakdown occurring so that it's not allowing them to participate in their functional tasks on a day-to-day basis? And we look at those functional daily activities as occupations of daily living. All right. So that's kind of where the occupational aspect came in. So if it is somebody that's having difficulty performing their daily job duties, then we do help people figure out where that breakdown is occurring and help them to kind of come up with ways to make that a little bit easier for them. So again, it's very much mind, body, and spirit oriented. So there's a lot of overall general healing that goes into this, right? And this is, again, what I love. I love this slide because it really encompasses everything. And there's no way that you can separate the mind and the body at all. This has been proven. It has a direct effect on things. We all know that when stress occurs, we lower our immune system, we tend to get sick, we have more aches and we have more pains, those kinds of things. And that's just on a very superficial level. So what do we learn as OTs? All right. And I'm just going to use OT instead of occupational therapist because it's a mouthful and it's a lot to say. So hence the acronyms again. But we learn all about the human body and the mind. So we actually have a ton of classes with our fellow PTs. A lot of our kinesiology classes, our neuroanatomy classes, all of those are very similar. We learn all about human development. We learn all the muscles and the nerves, the bones, and the entire human body. We learn about the brain and how it works. We also have a lot of classes in mental health. So a lot of psych classes, which is different from the PT curriculum. That's one of the areas that we differ a lot. And we have the kinesiology classes like the PTs do in terms of how the body moves. That whole brain body connection is something we look a lot about. Physics of the body and overall definite diseases. We look at, what are the disease processes and that kind of thing. I can't say the word disease for some reason. And the one big thing that is true for OT is we get to do this lovely thing called activity analysis. And this is sort of, I think, what sets us apart as clinicians. And when I was in school, I hated this activity because it was torturous. But we take an activity like picking up the mouse or dropping the mouse on the floor. Let's say I drop my mouse on the floor and I have to pick it up. So as occupational therapists, we have to assess what has to happen in order for us to pick up that mouse off the floor. What muscles need to be used in the entire body? What nerves are activated to contract those muscles to actually pull on those bones and on those joints so that we get actual joint movement? What cognitive things have to occur? How do we feel about that? Are we pissed off that we dropped it on the floor? What is the emotional state of the person that dropped it on the floor? And we have to look and analyze everything so we can see where that breakdown is, so that we can then rehab whatever parts need to be broken down. So if it's a lack of range of motion, we look at that. If it's a cognitive thing that they can't quite process how to actually bend over and pick it up, then we look at that. So we look at all of that, and it's a very detail-based analysis. And I remember in school, it was this whole portfolio kind of thing that we had to do. And again, it was very labor intensive because you're looking at every aspect of the body, how it works to do this one task. But I have to tell you that one task of activity analysis in school is proven to be one of the most beneficial things moving forward, and you get to the point where you do it much, much quicker. And it doesn't take quite so many hours to do. So this is kind of an overall view of like, what do we learn about as occupational therapists, right? And this is just the basic stuff. Once we get out of school, we can then take courses on all sorts of different things. And I'm going to kind of go into where occupational therapists work. So you have an idea of all the different areas that we can go into, which is very, very vast, which makes the field a very desirable field to go into. So we do a lot with adaptive equipment and education on adaptive equipment. We do home modifications, okay? We do a lot with birth to 3. There are therapists that work in birth to 3, sensory integration, that kind of thing. We work a lot with amputees, all right? So if that's a specialty that you go into, you can work a lot with prosthetics, all right? We work with spinal cord injuries and stroke patients, all right? We do wheelchair adaptations, all right, and wheelchair fittings, all right? We actually also do, OTs can actually work in driving schools for patients who have had trauma. A lot of times it's stuff with neurological things to make sure that they can get back to driving safely. So they'll actually have driving setups and car setups so that you can actually simulate that in the clinic as well to make sure that they're safe to get back behind the wheel. All right. OTs also work in the school system. So you'll see them in the school system. OTs also work in pelvic floor for women's health, which is absolutely amazing. I personally work with musicians a lot of the time because of my background in music. I teach a lot of different courses and work with musicians in terms of training and education as well. OTs work a lot with ergonomics, all right? So we have a lot of training in ergonomics and body mechanics. How is the body set up at whatever tasks they're doing? So I've applied my knowledge of instruments with musicians. I know what the instruments are like. I've played with every instrumentalist that there is pretty much. So I have familiarity with that. I don't play the actual instruments, all of them, but I've played with them. So I have familiarity of what those instruments entail to be played. I have a familiarity of how the body works and the ergonomics and body mechanics of what it should and shouldn't be doing and putting that body into a perfect position. And I do that at the person's instrument. So very much like when people do it at their computer desk. I take very similar things and apply my music knowledge with ergonomics and body mechanics and put that and do ergonomics in that way, not only at the worksite setting. And OTs work a lot in mental health, all right? So this is where all of our psych training classes come in. So you can work in a psych unit. You can do a lot with stress management. A lot of it is coping skills and that kind of thing. So that gets incorporated into things. I mean, if you take somebody who's had a trauma, who's had a really bad car accident, say there's a lot of mental health that goes along with that. There's some PTSD potentially, there's anxiety, there's fear, there's muscle guarding. All these things get incorporated into that person from that injury. And a lot of OTs are life coaches too, because of our training, and our training is so vast and in so many different areas that we can really work to help people become the best version of themselves in their life. So I do a lot of life coaching through my energy healing as well. I work with musicians, so these are sort of my specialty areas, right? And then obviously I'm a certified hand therapist. So when you're a certified hand therapist, you work a lot with the physical aspect of the body. So these are all just different types of injuries and different types of things. But when you can finish school, you can go on to learn lots of even more courses. The amount of courses, that continuing education courses that are out there is unbelievable. There's always something to learn, which is an amazing thing about this field. So I've taken classes on cupping and Graston technique. I've taken cranial sacral therapy classes, postural classes, shoulder classes. I've taken classes on pain management, kinesiotaping and rock taping classes. So these are all the different areas that I kind of focus in on. But if you're working in peds, you're going to take different continuing education. If you're working in a traumatic brain injury unit, you're going to take different continuing education classes. So again, all those different areas that you can kind of focus and niche down into, there's so much to learn in each of those settings, which is absolutely amazing. So this is just kind of a cool video. I'm just going to show you. This is a patient who had a really bad shoulder injury, and she ended up with what's called a radial nerve palsy. So this again is a great occupational therapy thing, because she has certain things she needs to get done during the day. And if you look at her wrist over here, she cannot extend her wrist or her fingers. All right, she can't extend her wrist or her fingers. So functionally, we looked at, what does she really want to do? She really wanted to be in the kitchen. So we made her this splint, and now she can pick things up and she can move things because her wrist is held in a certain position. And also the straps in there help her fingers to move more. So she can pick and move things that she couldn't do before, so that she can do those daily occupations of her life that she really wants to do as she waits for that nerve to heal back. So it was very cool, very amazing thing to be able to do. So again, that's a daily life task that she couldn't do because of a physical injury. A lot of frustration, a lot of depression around all of that as well. So just gonna, and again, this is an orthopedic injury, very common for things that we see as certified hand therapists. We have a bad fracture and then lots of plates and screws and hardware, and that takes a lot. This is from a significant fall. So there's a lot of fear and anxiety working around that, fear of falling again in this elderly patient. So you have to work a lot with that, you know. So you're dealing a lot with, I love this picture on the left because it's like bug-eyed, like, oh my God, there's so much panic over certain things. And there can be anxiety around all of that stuff. And the great thing about OT is that we are equipped to deal with all of these things because of our training. So we can really be truly holistic in nature. So my ultimate goal as a therapist is to help people find balance on all levels in their life. Like, I really want to help them find balance on all levels in their life so that they can get back to doing all the things that they love to do and that are important to them. Because honestly, when they come into you and say, hey, I can do this now, it is the best feeling in the world to know that you've helped somebody reach their goals. And ultimately you're there as their guide. But it's a great thing to be able to do. So I hope that explained a little bit about what occupational therapy is. I'm not actually going to go too much into PT because they can describe their own field, but OT is really about the mind, body, and spirit aspect of combining things. So we're not just looking at the body, we're looking at the entire picture. So if you have any questions, comment them below. Please like and subscribe to my channel. And I hope to see you soon.